Navigating pregnancy is, well, it's an amazing journey, but wow, does it come with a ton of questions. Especially when you're not feeling your best. It can get so overwhelming trying to figure out what's actually safe for you and your baby. So let's dive in and try to clear some of that up. I mean, you've been there, right? Standing in the pharmacy aisle, just staring at all those boxes, wondering, what can I actually take? Suddenly, a simple headache feels like you need a PhD to solve it. It's such a common feeling, and trust me, you are not alone in this. So, to help get a handle on this, we're going to walk through a guide from the Canadian Pharmacists Association. But first, and this is super, super important, a big heads up. Think of this explainer as just a way to get you prepped for a conversation. It is not, and I repeat, not a substitute for real medical advice from your own doctor, okay? Cool. All right, first up, let's tackle one of the most common reasons you'd even reach for a medicine cabinet. Just aches, pains, and fevers. So what's the go-to for finding some relief when you're expecting? Well, for general pain or a fever, the guide pretty much points a big arrow right at acetaminophen as the first choice option. And yeah, this is probably what your doctor would bring up first, mainly because it's been around for a long, long time and has a really solid safety record during pregnancy.
Okay, but here's a really, really important distinction. The guide is super clear about avoiding NSAIDs, that's things like ibuprofen or naproxen, and full doses of aspirin, also called ASA, especially in the third trimester. That is a huge takeaway, right? Something that might be fine earlier on is a definite no-go later in the game.
All right, moving on. Let's talk about colds and allergies. And honestly, if you thought pain relief was a maze, that cold and flu aisle can feel like a whole other level of confusion. So, what happens when your allergies go haywire or you catch that dreaded cold? What can you actually do for that drippy, runny nose or that completely stuffed up feeling that is just so frustrating?
For the allergy side of things, the sneezing and runny nose, the guide leans toward what are called second-generation antihistamines. Think cetirizine and loratadine. The main reason? They're way less likely to make you drowsy compared to the older stuff.
Now, for a stuffy nose, actual congestion, the game plan's a little different. The guide suggests starting with something really simple, like a saline nasal spray. It's basically just salt water, so no medication involved. If that doesn't do the trick, then a decongestant like pseudoephedrine is mentioned as another option. But, and this is a big but, this is where things get a little tricky. The guide points out that the research on pseudoephedrine, especially in the first trimester, is a bit conflicting. See, an older study raised a flag, but then a newer, much bigger one didn't find any increased risk. And this right here is the perfect example of why you've got to talk to your doctor. The data isn't always black and white. Okay, let's shift gears and talk about tummy troubles. Because, let's be real, pregnancy can throw your whole digestive system for a loop, right? We're talking constipation, heartburn, you name it. When it comes to constipation, the guide's philosophy is basically start gentle. It favors things like bulk-forming agents. Psyllium is the stuff you find in a lot of fiber supplements, and also stool softeners. The whole goal is to, well, make things move more comfortably without bringing in the heavy hitters. And speaking of heavy hitters, this is a super critical warning. The guide points out that stimulant laxatives, like Senna, need to be handled with major caution. They should only be used for a very short time, because there's a potential risk they could actually induce uterine contractions. Yeah, that is definitely something you want to know. And what about that lovely pregnancy heartburn? Well, you've got a couple of types of options here. The guide mentions things that work right away to neutralize the acid, your basic antacids, and also meds that work a bit differently by telling your stomach to produce less acid in the first place, like famotidine. All right, so we've gone through a few specific problems. Now let's kind of zoom out for a second and talk about some big picture safety rules that really apply to everything. Here's a great rule of thumb that comes up in the source material. Whenever you have the choice, a local treatment is often better. Like a nasal spray that just works in your nose or a cream for a rash. And the reason is simple, right? It just means less of the medicine gets into your whole system, into your bloodstream.
There's this quote tucked away in the footnotes of the guide that I think is so important. It basically says that a lot of over-the-counter stuff isn't on the recommended list just because there haven't been enough studies on it during pregnancy. It doesn't automatically mean it's unsafe, it just means we don't have the data. Which, you guessed it, is another huge reason why you need a pro to help you navigate.
So if you take away just one thing from all of this, what should it be? It's this. Everything we just talked about is a starting point. That's it. Your number one, non-negotiable, best resource is your healthcare provider. Your doctor, your midwife, your pharmacist.
They're the ones who know you. So with that in mind, let's get you ready for that conversation. How can you make your next chat with them super productive?
Okay, here's a super simple 3-step game plan. Step 1, get really specific about your symptoms. Don't just say, I have a headache. Is it throbbing? Where is it? Step 2, you now have a basic idea of the common options, which is awesome. And step 3, you take all that info with you to your appointment. That way, you can have a really smart, confident conversation and figure out the absolute best plan for you.
See, the goal here isn't just to give you answers. It's to help you ask better questions. Having this kind of framework in your back pocket can make a world of difference in feeling like you're in the driver's seat of your own self-care. And that's huge. So now that you've got this, what's the first question you're going to ask?